this person is the Executive Director from Para Excel, David Dent. So over to you, David. Thank you very much.
Thank you. Thank you very much. And yeah, really interesting discussion so far. And I've been making some notes on what some of the other speakers have said, because there's some really important points. So I have a disability. I spent a lot of my life working in the public service, initially in the health service and then in the Army Medical Services. I was injured in combat from a blast injury, and I now use a wheelchair. I have other traumatic injuries in terms of spinal injury as well from my service, and so I have that kind of lived experience as the first thing. As you can see, I'm Executive Director in Par Excel, which is an international clinical research organisation. So we run clinical studies on behalf of biotech and pharmaceutical companies around the globe. We're about 24,000 people. We've got offices in about 50 countries. But also I co-chair and lead disability strategy group from within the organisation to improve all of these things that we're talking about. So I'm going to kind of touch on a few areas really kind of based on my experience. But to start off from a DEI perspective, 90% of organisations have a DEI strategy, diversity, equity and inclusion, but only 4% of those actually include disability within that. So we have quite an evolved DEI network. And to some of the points that, you know, particularly Mark was talking about just now, we have quite an established record in terms of gender, and particularly around the gender pay gap, gender progression. I know we as a company have published that data, and since publishing that and putting interventions in place to improve it, we've certainly improved that. So I think the data and measurement piece is really important. But a lot of this is that we have other minoritized groups that have trodden a path and shown us a way. And a lot of what I did with our disability strategy group was to follow some of those pathways. So how do you get rid of unconscious bias? How do you kind of train managers and individuals into removing some of those myths? And we talked about this earlier with Mark, that, you know, some of those myths around, you know, people with disability are going to be off sick more. It costs more to make accommodations for people with disability. There's some global research that shows that 90% of accommodations don't actually cost anything. And depending on which country you sit in, Spain has just really taken a step forward in terms of its disability inclusion, and that's been led by central government. And if you visit there or you happen to go work there, you'll see a lot of changes that have been made. So it always surprises me that when 90% of organisations have a DEI strategy, but only 4% of those have disability inclusion within that. Why is that the case from enlightened groups of people? So disability is that kind of forgotten cousin within this process. So we're talking about different disabilities, and I think this is a really important point. So you know, the disabled community is a wonderful community because there is so much diversity within that. You know, there's acquired disabilities like mine. So, you know, obviously being a soldier in the army, I didn't have a disability at that point till I got injured. So you can acquire it, and there can be health-related conditions. There can be, you know, accident-related conditions. There could be, you know, diseases, other bits and pieces that can impact on that, or you could be born with a disability. Now, my experience of somebody who's blind, or, you know, I do have hearing challenges, so I have that personal experience, but I don't know what it was like to be disabled from birth. I don't know what it's like to be blind. I don't know what it's like to have autism that causes a disability, not in all cases, but in some cases. But that diverse community, there's not a single person that can represent that. But it does mean that you've got such a variety of experience, lived experience, which is critical to be able to inform these things. Now, one of the challenges that I see in business particularly is that disability is treated under what's called the medical model. So, and even a lot of the government populations talk about long-term health conditions rather than disability. Now, I'm a very healthy person. You know, I think in the 37 years or so that I've been working, apart from my injury, I think I have less than a dozen sick days. So I don't do sickness at all. You know, from an achievement perspective, I'm head of market and business development for IMEA. So I'm a senior level leader within our organisation and a wheelchair user, as I've already mentioned. But you don't see a lot of people like me using a wheelchair. Now, some of this is just not is worrying about the discrimination, or there's an element of pure ableism. There's an element of institutional ableism, and there's an element of unconscious discrimination. And thankfully, it's the unconscious discrimination which is the biggest part, and that can be educated and it can be supported through allyship. But when we're talking about employing people, representation is important, and the disability confident badge, whether that's level 1 or level 2 or level 3, having that on a website signals to people we are open, we are friendly to employing people with disability. Having representative images, I know I feature in articles, in social media posts for our company, as well as other organisations that I work with. I've kind of co-published with the Chartered Management Institute, where I'm a companion, and they have a great report called the Everyday Economy, which focuses on all elements of diversity. But there are some practical steps as to how you can do that. But seeing people, and it doesn't matter what your minoritized community is, seeing people like you, whether you're black, whether you're female, whether you're disabled, whether you're gay, you know, seeing people like you in that organisation signals that we're open to that. And from an employment perspective, we've done this for other communities, we deliberately target employment groups that will support. So, you know, we advertise in pink jobs for the LGBTQ plus community. We advertise in black pharma for the, you know, for our kind of approach as well. Now, getting people into employment is one thing, and colleagues from Access to Work and Mark and people earlier were focusing on that. I think the retention is really important, and what Mark Russell's team are doing, I think, is great, because you need to measure stuff as a business leader. You know, you can't make an impact unless you measure it. So you need to measure it, and taking that step to publish it is a great step, because nobody is perfect. We're not perfect in terms of the gender pay gap. We're not perfect, certainly, in terms of disability, but having the confidence to do that and show people that you're on that journey is really, really important. I think I talked about the medical model. One of the easiest steps organisations can do is move away from the medical model and go to the social model. Because what happens is your HR departments and your business leaders end up spending a lot of time while people try to prove their disability. When actually enlightened businesses, if they just ask every employee, how can I make your job easier? The boost that you get from the able-bodied community, as well as people with disability, is really important. You find that is not a difficult thing, whether that's the working from home piece. All of our employees, apart from those that visit hospitals, have the ability to work from home. It's completely free choice, because we don't measure people by clocking on and clocking off. We measure people by their outputs. So thinking about what are your KPIs, how do you measure that? One of the other elements, and again, this might be a little bit controversial in terms of employee resource groups. What I find is really important is executive sponsorship. So we've had mention of Valuable 500. We work with a global organisation called Disability In, because we have a heavy presence in the US. But being able to kind of signal that openness is important. So we work with a charity who supports people with autism, and we thought we want to increase the population of people with disability, particularly neurodiversity within the organisation. But what you found was, because of the discrimination that happens in school, in universities, particularly with people with autism, they weren't having the academic achievements that were traditional. So we worked with the organisation, and we had 20 jobs that we were looking for. And we adapted the assessment. We forgot about the exam results. We just said, okay, here's a practical assessment to do this job within data management. And we'd normally get about 40, 50 candidates applying for those types of roles. We ended up with 140 people. And out of that 140 people, 100 passed the assessment. But we were kind of really sad that we only had that amount of jobs. And that was purely by negating that societal imbalance that's happened through people's education and attainment. So I think that's really important. One of the figures that is a challenge is retention. So getting people in the door is one thing, and it's something that we can focus on. But retaining those employees, having them at the right level, because a lot of people with disability are employed at lower levels in the organisation in terms of their job role, their pay, making sure that you have a spread, making sure that your progression is done. Now, we measure this, most companies measure this from a gender perspective. So the systems and processes by which you can measure it. And the other thing I'd like to say on employment is that we have a risk, particularly with the use of AI in CV screening. You can pick up, employment gaps, or somebody like me went into hospital for rehabilitation for a period of time. Why were you not at work for a month, or whatever that happened to be? So we've got to be careful that we don't allow this automation and the algorithms to build in this discrimination into the process. So I talked about return and retention, representation and decision making. There's broader representation of that diverse committee. I meet a lot of people who talk around disability inclusion who don't necessarily have that lived experience. And I think that having that lived experience does bring a slightly different perspective. And I think it is critical. We have disability advisory groups, we have patient advisory groups to help inform all the things that we do. So ensuring that we have that in place, I think, is important. We've heard about the kind of employment gap. We know about the Great Resignation. We know about the skills challenge. It does really seem to be that there's a lot of people who are willing and able to work, who are high achievers, who have low sickness rates, who have experience because of their lived experience, where they tend to be more resilient, more adaptable, more innovative. And also there is this broader spread of the uplift in able-bodied colleagues as a result of having to support, maybe be friends with, understand the lived experience from somebody that's not like them. There is a cultural uplift, and culture is a huge important element to this. So one of the couple of things we focus on is, one is cultural engagement, education, telling lived stories, telling those real experiences. So people are no longer kind of frightened of the unknown. They understand that reason. Why is an able-bodied person supposedly going into the disabled toilet or the accessible toilet? Well, one of my colleagues has Crohn's, she has a stoma. She has to go change her stoma bag. She needs to put space to lay things out, but she quite often gets people in the general public sort of disapproving, because why somebody, everybody assumes a wheelchair user is the only person that can use, the disabled toilet, and also, 70% of people who use wheelchairs are not permanently in their wheelchair. So when we talk about people wheelchair bound or stuck in a wheelchair or whatever, that's not the case for 70% of wheelchair users. So using the right language, using inclusive language, but the underlying message for me is that people with disability are part of every community. So 1 in 4 women will have a disability at any point in their life. You know, you can be part of any other community, obviously, as well. So when we think that we've solved problems for gender, or we've solved problems for race, ethnicity and culture, or for the LGBTQ plus community, and we haven't even looked at disability, let alone the intersectionality that exists, we haven't solved those problems either. And then just one kind of final comment really was around, you know, Mark from Scot at the beginning was talking around the you know, the fund. You know, I think there's for me there's a lot of the practical challenges, because we've just recently in the news heard about this really horrible and disgraceful situation for women who've had mesh implants, and I know that that organisation and the review that's being conducted is suggesting a fund to help support these women get to where they need to get to. Well, actually, the similar thing applies for people with disability as well, because the Equalities Act is fine because it says everybody is equal. And if there's discrimination that exists, then you can use the Equalities Act. But actually, how do you use it? If a lot of the disabled population isn't in work or is having support for all the reasons that we've been talking about today, it's required the individual to then take an organisation to, you know, through that process of the Equalities Act. Now, a lot of businesses will use third-party offices. You know, they'll rent their offices and all the rest of it. And if you kind of say, look, there's an access challenge here, then the answer is, oh, we were covered under the DDA when that building was built and we're compliant. Therefore, we don't need to do anything about it. Your only redress then is to go through the Equalities Act, which again, as I said, doesn't really have, you know, the ability to do that. But there is some kind of broader societal elements, even in terms of the built infrastructure. You know, there's a common term that is the environment that makes you disabled. You know, and I travel internationally, I work all the time. I don't have a problem with that, providing the environment is accessible for a wheelchair user. But still, even in universities, 90% of architecture courses do not teach accessible architecture. So anyway, I will kind of draw a line there. I know that was probably quite a lot of rapid different points, but it was a very broad subject matter. And Amy, I will pause, happy to support with the rest of my colleagues any questions. So thank you.
No, thank you so much, David. That was really, really interesting, really in-depth, really useful information. And I've certainly taken some really key points as well to take away back into HMPPS.